Good afternoon, everyone. My name is Sasawan Attaworakun. I'm a master's student major in community nurse practitioner from the Faculty of Public Health, Mahidol University, Bangkok, Thailand. Today, I would like to present my master thesis titled Effect of Supportive Educative Nursing Program on Self-Care Behaviors Among Monks with Metabolic Syndrome in Bangkok metropolitan area. Here is an outline of my presentation today. Metabolic syndrome is a major public health problem around the world. Figure 1 shows different percentage of metabolic syndrome in continents. In Asia, about 31% of total people had metabolic syndrome, of which 20% were men and 15% were women. Including Thailand, the trend of metabolic syndrome was also increasing. And the highest prevalence of metabolic syndrome in Thailand was found in Bangkok. Metabolic syndrome is defined as a cluster of conditions including abdominal obesity, high blood pressure, high blood sugar, and abnormal cholesterol or triglyceride levels. Metabolic syndrome can affect abdominal obesity, lack of self-esteem, loss of confidence, and leading to chronic disease, including hypertension, diabetes, and developing to cardiovascular disease and depression, which require high cost and long-term care. This slide shows the mortality rate per 100,000 population with non-communicable disease have been increasing every year, and the highest mortality rate was cardiovascular disease. From literature review management of metabolic syndrome, the goal is to reduce risk of metabolic syndrome by controlling weight 7 to 10% of body weight within 6 to 12 months. From several studies have shown that weight loss results in better weight of blood pressure, blood sugar, and lipid levels. And we found that the principle of weight loss is energy imbalance by eating less than your energy needs and increase energy by exercising or use both ways. For Thai monks, there are 227 strict rules due to strict life of Buddhist monks, make them have minimal physical activity than general people. And they also cannot exercise like general people. Exercise must be composed and do in private paid. From table 1 show that the daily routine of monks, that they had more 3-time activities a day for about 50 to 60 minutes as following. For walking in the morning for receive food by marriage maker or devotees, or alms round for about 50 minutes. And then for free time, they can do another activity including cleaning a temple or washing clothes. Most of them had more sedentary lifestyle than general people. And they cannot choose their own food and have to accept what they are offered by marriage maker. Although they have 1 or 2 meals a day, mostly food they receive were more sugar, fat, sodium, and low fiber and protein deficiency, which puts them to higher risk of metabolic syndrome than general people because of intake is not in balance with their daily use. In addition, health service from monks focus more on medical treatment than health promotion. From health report in 2015, it was found that monks had got admitted in priest hospital with disease of metabolic and lipid metabolism, hypertension, diabetes. These top 3 conditions are associated with metabolic syndrome. And monks have less opportunity to use healthcare service than general people because of their daily monastic life and their limited access to health promotion activities. Here is my literature review of this study. I reviewed lifestyle and health promotion in monks, health situation in monks with metabolic syndrome management, supportive educative nursing program, and related research. From literature review, it was found that prevalence of metabolic syndrome continue to be higher among monks in Bangkok area metropolitan, and monks had less health literacy on self-care practice to prevent metabolic syndrome. And from previous studies showed that effect program from metabolic syndrome were limited and cannot apply for monks, and some activities cannot apply for monks too. This study was to examine the effect of supportive educative monks nursing program on self-care behaviors among monks with metabolic syndrome in Bangkok metropolitan. Here is my conceptual frameworks. Supportive educative nursing program as independent variables, including raising awareness about metabolic syndrome, setting goal and self-care plan, self-care skill training, supporting and coaching self-care, and creating supporting environment for self-care. And the right side were effect of this program, including self-care behaviors, body weight circumference, clinical outcomes, including blood pressure, fasting blood sugar, HDL cholesterol, IDL cholesterol, and triglyceride levels. This study was a quasi-experimental research with pre-test and post-test through group designs. Here is study population and sample. The sample size was calculated by G-Power program and used multi-stage sampling. First, we randomly selected Central Bangkok area with 18 districts. And second, district with 17 temples was selected at the study area. Third, 4 out of 17 temples was randomly recorded as experimental group and comparison group. Fourth, 30 participant monks who met inclusion criteria and exclusion criteria were invited to participation in the study. For example, in this study were monks with metabolic syndrome, who were 3 of 5 on criteria of metabolic syndrome, and who were 30 years and over. For inclusion criteria, including age of ordination equal or more than 3 months, who can communicate and write in time, and who can contact by phone. For inclusion criteria, including blood pressure more than 160 per 100 millimeter of mercury. fasting blood sugar more than 300 milligram per deciliter, and who can participate in this study. Here is research instrument and psychometric test. Instrument for data collection developed by literature review and related research. Questionnaire consists two parts. Part 1, personal data, including age of ordination, weight, body mass index, weight circumference, education levels, diagnosis, drug, and right to health care. For part 2 was Likert type scale with 4 response for measuring self-care behavior, including diet, physical activity, and risk behavior regarding metabolic syndrome. For this study, content validity index was 0.92. And for internal consistency of this study was examined by Convac alpha coefficient, which was 0.75. This study was conducted to examine the effect of 6-week supportive educative nursing program among 60 months. Before the intervention, both groups received health screening and risk assessment with metabolic syndrome. For experimental group, they received week 1, they received pre-test, health education, and practice skill training. Week 2, they received group support, group meeting. Week 3, 4, and 5, they received weekly telephone follow-up and feedback information. Last, week 6, they received group support and post-test. For comparison group, week 1, they received P-test, and then they received regular service from public health center. Last, they received post-test in week 6, same the experimental group. This slide shows health screening in both groups. Health screening including weight and height measurement, blood pressure measurement, and blood chemistry tests. And after health screening, both groups did pre-questionnaire by the researcher and research assistant. For week 1, the experimental group, first, they received P-test and setting self-care goal and planning, and then they received health education and skill training. Health education and skill training including diet control, physical activities, and avoiding risk factors regarding metabolic syndrome. For diet control, we use food pyramids which apply to fish from monks with metabolic syndrome. And then we use stoplight nutrition, which foods are categorized to correspond with the color and meaning of stoplight. The goal is for monks to eat more green ripe foods with healthy choice. There were low sugar, low calorie, low fat, and high fiber. And then we use food exchange to help them make healthy food choice. For physical activities, this study focused on increased physical activity continue more than 30 minutes a day. And do another activity, for example, walking in the morning for received food more than 30 minutes a day. And practice skill training about SKT meditation more than 30 minutes a day. And then we practice skill for avoiding risk factor about metabolic syndrome. This study focused on avoiding smoking and avoiding drinking energy drink such as soft drink, caffeine drinks. For week 2, they receive group meeting. They receive the knowledge and skill renewal that they got in the first weeks. Then week 3, 4, and 5, they receive weekly telephone follow-up to monitoring 3-day food record and physical activity records to follow up their healthcare, self-care, to give advice, feedback information, purpose to continue their self-care and practice. For week 6, group support, sharing, and evaluation purpose to exchange their practice and their practice in 6-week intervention and evaluation self-care behaviors. Data collected by the researcher use the questionnaire and bus chemistry test before and after the intervention. Data analysis use descriptive statistics and t-test analysis. After 6-week intervention, only 54 subjects were complete for data analysis. For experimental group were 29 subjects and comparison group were 25 subjects. Both groups, there were no significant differences in terms of the demographic characteristics. From Table 2, show mean score of self-care behavior between experimental group and comparison group. At post-test, there were significantly higher than the pre-test and higher than the comparison group within group before and after intervention. It could be a result in activity providing health education and practice skill training and group support, group meeting, including weekly telephone follow-up. This slide shows the result. From independent t-test analysis, there were no significant differences of mean score of body weight, weight circumference, and clinical outcome. But from paired t-test analysis, there were significant better than differences of mean score of body weight, weight circumference, blood pressure, fasting blood sugar, and LDL cholesterol. It could be a result in activity providing practice skill training about diet control, increase physical activity, continuous more than 30 minutes a day, and use weekly follow-up, telephone follow-up, and include practice skill avoiding risk of metabolic syndrome. This focus on smoking and drinking energy drink. In summary, hypothesis number 1 and number 2 were accept alternative hypothesis. After 6 weeks, the intervention among subjects with metabolic syndrome had higher mean score of self-care behavior than before the intervention and than the comparison group. For conclusion and recommendation, it was found that the findings support that the supportive educative nursing program could improve self-care behaviors among monks with metabolic syndrome, and healthcare service from public health center should provide health promotion program to promote health and well-being of monks. And a community nurse practitioner should apply the supportive educative nursing program to promote and monitor cell care among monks with other chronic disease and other communities. A future study should examine the retention of cell care behaviors and the long-term effects of the program on clinical outcomes. Last, I would like to end my presentation with a special thanks to graduate study of Mahidol University Alumni Association for partially support of this study. And in addition, I would like to thank 2018 KGC Organizing and Steering Committee and Kyoto University School of Public Health for fully support of my participation at this conference. Thank you for your attention.